let's move on to the Joint Commission. To add more fuel to the fire of confusion here, or add more mud to the water. They've just recently revised their guidelines to include language access, but they've used it, they're referencing it as a patient safety measure instead of a patient experience one. So strategically, like, what is that? Why would they do that? What does that mean? And then and then let's talk a little bit more globally, like what is language access in respect to patient safety, or how do you view its role as part of patient safety?
I love this. I love that they have pivoted in that direction, because I think language access has been seen as an adjunct or a nice to have in a lot of cases, when really without effective language access, without effective communication, safe care is not possible. Whatever your doctor is telling you, whatever you're telling your doctor, it filters through the interpreter. So if there are communication failures, that means there will be patient safety failures. So that's why it is so important to make sure that interpreters are qualified, that they are medically experienced, and that you're able to have this effective communication in the triad, the patient, the provider, and the interpreter. I think that some common ways that language access improves patient safety is it prevents diagnostic errors. Informed consent is huge, that a patient can't meaningfully consent to treatment if they don't fully understand the risk, the benefits, alternatives in the language that they comprehend. And there are, some people will say, oh, they know English good enough. And that's not, just because someone might be conversational in English doesn't necessarily mean that they want to receive their healthcare information in English. So informed consent is huge. Medication errors, when patients are discharged, they first of all, regardless of language, I think that errors can happen more frequently when patients are discharged, because they go home and they think they understood their instructions, but they forgot, when am I supposed to take those meds? Or when was the last time that I had that med? Can I take it again? So medication errors happen, adverse drug events happen. Add that barrier, that language barrier, on top of the complexity that, from someone's diagnosis and treatment plan, that can definitely increase harm, or risk of harm. Readmission rates, that's another thing. If your patients if they understand their treatment plan, if they understand their options, then their errors are less likely to happen. Readmissions are less likely to happen. Following treatment plans, compliance with treatment plans is higher, is more likely if they understand the why behind their treatment. And all of those, of course, rely on clear communication. And I think patients tend to, I can tell you, my parents who are older but do not speak another language, they rely heavily on me to make sure that they understand what their treatment plans are. So a lot of our non-English speaking patients do the exact same thing, rely on family to understand their treatment plans, or have that second person in the room to follow instructions that are given. The problem is, a lot of times we try to use those family members to interpret. And there's a few different issues with that. One is the family member that's interpreting or trying to interpret no longer gets to play the role of the family member or the support person. Now they're having to act as an interpreter, and there's so much more that goes into interpreting than simply being bilingual. So that's one thing. And then the other big thing is we don't know if the family member or friend understands medical terminology that's being used. Will ask if they don't understand something. They don't, nobody likes to look like they don't understand what's happening. So people tend not to ask. And then we also there are some cultures where you just don't share bad news with the patient. So we don't know for sure when we use family or friends if everything we're saying is really being interpreted. So there's a lot of issues there with when it comes to patient safety and ensuring that you're using a qualified interpreter, a vetted qualified interpreter.